Chicago Family Health Center is a primary medical home for thousands of residents on the south side of Chicago.
Chicago is a very, very big city. So it's very important for patients to have healthcare centers in that community. That way, it's easier access.
We're in a neighborhood. We're in their community.
People can walk here. They have friends drop them off. We're very central and local and accessible.
We work with patients and family members of all economic backgrounds, come from different backgrounds in family life and stages.
My patients that I see typically look like me. To be a provider in those spaces and you can reflect your community, there's a certain level of trust that the patients end up having with you.
We're like their advocate. We're their shoulder to cry on. Sometimes people come and you just think oh, I hurt my finger, and then you get them in the room. They're being abused, they don't have nowhere to go, they don't have nobody to talk to.
People already have a hard life as is. If we're just able to help them in that health component, that health aspect, that's such a huge thing.
We have dental, we have medical, we have pediatrics, we have OB, geriatrics. So we have abundance of the holistic body care for the patients in all economic backgrounds, especially in the community.
The neighborhoods that we are in are the more lower served communities, so being able to come here, us being here and able to help them, I think they value that most.
Recent events has really changed the funding dynamics for federally qualified health centers.
Pharmacies closing, insurance changes, there's all of these changes that are occurring. Definitely can have a negative impact on the people that we're serving.
What that means for Chicago families, what that means for our communities, is ultimately people are not going to have insurance and aren't going to have access to services.
Missed appointments, decline in health care because they can't afford the medication, refills aren't sent, patients don't follow up, so it's kind of hard to gauge treatment.
More people being sick, kids not being able to be vaccinated, our elderly, the medicine.
Wait times are much longer, and patients who need to be seen in a more timely fashion, it gets delayed, and then we're backing up the hospitals.
The assistance with the milk and the free vegetables, if they lose access to that, then it would take away from the children in the household and what they're eating.
When all of these changes were taking place, it was very scary. I can only imagine what some people may go through trying to navigate changes to insurance and things being cut.
We really would love to expand services. Us opening up a pharmacy so that we can have that continuity of care for our patients is important.
When I was at South Chicago and the pharmacy right next door closed, patients didn't know where else to go. It was like, how am I going to get to this next pharmacy? How far is it? Do you know which one's the most local one? Now it was on us to try to help them, because if we don't help them, who is?
I feel for those areas who do not have that access to those important meds. To have pharmacies available to me in areas that I need it, I don't know what I would do without them. I don't know where I would be.
Chicago Family has been an organization that's been in community for 48 years, and we plan to continue to be here in the same way that we have been. We want more than to just survive this moment. We want to grow, but we can't do it alone.
Strategic partnerships have always been important, particularly when serving some of the highest needs areas in the city.
We need the help, we need the support.
It's crucial, and it is very, very needed, particularly in the times where there is a lot of uncertainty.
I very much appreciate every little bit that we've gotten to be able to keep our doors open and to be able to serve the population, because the work that we do here is very important, especially now with limited access to healthcare. We're one of the last few places that they can kind of seek that type of health information that they really need.
We're all here together to help each other, to uplift each other in whatever way we can. I just want to thank everybody who has given time, whether it's support, financial, communication, being there, a hug to patients like myself. You just don't know the impact you are having in somebody's life.
For the people who have continued to support Chicago Family Health Center, I thank you. You are doing an important work and enabling us to do important work as well. I ask for your continued support, particularly during these trying times and all of these changes. And I look forward to continuing to work with you all.